Well, top U.S. health officials say the current vaccine strategy for COVID-19 is not working. The CDC says fewer than 7 million people received the first dose. And we're learning some hospitals are being forced to throw away vaccines that have expired. Each vial contains 3 doses, but sometimes there aren't enough people to vaccinate. Well, as healthcare workers continue to administer the COVID-19 vaccine across Montana, there seems to be some confusion about who is eligible and when. Well, Montana is still in the first level of distribution, meaning shots are only intended for first responders, medical staff, and long-term care. Teachers, who are considered frontline workers, are in the 3rd level. Well, tonight we're learning that St. Vincent Healthcare vaccinated local educators last week in an invite-only clinic. But hospital administrators tell us when medical crews figured out what was happening, they went ahead and vaccinated anyway. Q2's Andrea Lutz is following this story and is standing by now with more on how this happened. Andrea.
Yeah, Janelle, so here is what happened. St. Vincent sent out an invitation letter to a limited number of healthcare organizations with a code. That code would allow you to register for an appointment online and get the vaccine under the Phase 1A. We're told that letter and that code was shared to a number of local educators who registered and received the vaccine at a clinic on Thursday night. But staff at St. V's say by Wednesday night they received that letter, realized that the code was shared with local teachers, and that's when they chose not to cancel those appointments because they didn't want to waste the vaccine. Now, every hospital has to answer to the state of Montana and account for the doses they get. And while they plan now to reconfigure their system, St. V's again says the goal is to never waste any supply.
So the biggest mistake we can make in this whole vaccination process is having a dose of vaccine that wastes. We don't want to waste any. We want it to get into somebody's arm. We're doing our best to follow the plans as we've been given them, and we've developed our plans. But the biggest waste would be having a dose go to waste, and we are not doing that.
Yeah, so going forward, St. Vincent is now in the process of scrubbing appointments for that vaccine clinic to make sure that only Phase 1A folks get in for now. In an attempt to figure out this entire process, I got online and was able to get a vaccination appointment through St. V's My Chart. I used that code and I got in. I had an appointment scheduled for Tuesday at 6 p.m. However, as I left my interview with St. V's administrators regarding this entire issue, that is too when my appointment got scrubbed, canceled, and I was notified by email and a phone call about it. So again, if you are wondering, yes, anyone who's already been given that first dose of the vaccine will still get the second dose. A lot to be figured out here. Janelle, back to you.
All right, thanks so much, Andrea.